How do Afirma and ThyroSeq test thyroid nodules? Imagine having a lump in your neck that's hard to tell if it's harmless or something more serious. That's where molecular testing like Afirma and ThyroSeq comes into play, helping doctors make smarter decisions about thyroid nodules with uncertain results. When a doctor performs a fine needle aspiration biopsy, sometimes the cells collected don't give a clear answer about whether the nodule is benign or malignant. That's when these advanced tests come into action. They analyze the genetic material from the nodule cells to assess the risk of cancer more accurately. The Afirma test, especially its latest version called the Afirma Gene Sequencing Classifier, uses next-generation RNA sequencing. It looks at messenger RNA patterns in the cells, focusing on gene expression and variations in nuclear and mitochondrial RNA. This test is mainly designed to rule out cancer, meaning if the result is benign, there's a very high chance the nodule is not cancerous. Its sensitivity is very high, around 91 to 100%, so it's excellent at identifying benign nodules. The specificity, which helps confirm malignancy, has improved over time and now ranges from about 59 to 89%. If the Afirma test indicates a nodule is benign, doctors often recommend monitoring rather than immediate surgery. ThyroSeq, particularly its third version, takes a slightly different approach. It uses both DNA and RNA analysis to look for genetic mutations, gene fusions, and other alterations across more than 100 genes linked to thyroid cancer. This makes ThyroSeq a versatile test that can both rule in and rule out cancer. Its sensitivity is around 97 to 98%, and its specificity is about 82 to 85%, meaning it's quite good at distinguishing malignant from benign nodules. When ThyroSeq finds genetic changes associated with cancer, it suggests a higher risk, guiding doctors to recommend surgery. Conversely, a negative result indicates a low risk, supporting a more conservative approach. In the clinical setting, these tests are mainly used for nodules classified as Bethesda Category 3 or 4, which are indeterminate on cytology. They help reduce unnecessary surgeries by identifying nodules that are very likely benign. Studies show that if the molecular test is negative, the chance of cancer is very low, around 2 to 4%, allowing safe observation. If the test is positive, the risk of cancer increases significantly, often between 56 and 67%, which supports the decision to proceed with surgery. The choice between Afirma and ThyroSeq depends on various factors like availability, cost, and the specific clinical scenario, but both are valuable tools in personalized thyroid care. In summary, Afirma and ThyroSeq analyze genetic markers in thyroid nodule cells to better understand cancer risk. Afirma focuses on gene expression patterns to rule out cancer, while ThyroSeq looks for specific genetic mutations to both rule in and rule out malignancy. These tests complement imaging and biopsy results, helping patients and doctors make more informed decisions, avoid unnecessary surgeries, and tailor treatment plans to each individual's risk profile. Always remember, discussing these results with a healthcare professional is essential to determine the best next steps for your health.